Hello, welcome back to the channel. If you're new here, don't forget to hit that subscribe button so you never miss out on the latest updates. And make sure to watch till the end to see the sources and verify the news for yourself. Now, let's dive into today's topic. Motsoaledi shakes the nation, no patient will be turned away, papers or no papers. In a bold and compassionate move, South Africa's Health Minister, Dr. Motsoaledi, has reaffirmed the country's commitment to universal healthcare by declaring that no patient will be turned away from public health facilities, regardless of their documentation status. This statement has sent ripples through the nation, sparking debates and discussions on the accessibility and inclusivity of South Africa's healthcare system. Dr. Motsoaledi's declaration comes at a time when the country is grappling with challenges in its public healthcare system. Issues such as budget cuts, infrastructure challenges, and human resource constraints have placed immense pressure on public health facilities. Despite these challenges, the health minister has emphasized that the solution is not to deny care to those in need but to address the systemic issues that are affecting the quality and accessibility of healthcare services. One of the key points raised by Dr. Motsoaledi is the fact that many African countries, including South Africa, face challenges in registering all their citizens. In South Africa, approximately 11% of the population is undocumented, which translates to about 6 million people. These individuals, despite lacking formal documentation, are still citizens of the country and deserve access to healthcare services. Denying them care based on their documentation status would not only be unjust but could also lead to dire consequences, such as untreated illnesses and preventable deaths. Furthermore, Dr. Motsoaledi highlighted the potential legal implications of denying care to patients without proper documentation. He pointed out that if a pregnant woman were to be turned away from a hospital and subsequently gave birth in the street, the consequences could be catastrophic. Such scenarios could lead to legal actions against healthcare providers and the government, further straining an already overburdened system. The health minister also addressed the claims made by groups like Operation Dujola, which have been protesting against the treatment of undocumented foreign nationals in public healthcare facilities. Dr. Motsoaledi cautioned that these groups might be addressing what they perceive as a legitimate problem but are doing so using the wrong means. He emphasized that the law should be the guiding principle in resolving such issues, not vigilante actions that could harm innocent lives. In response to growing concerns over access to healthcare, Dr. Motsoaledi reaffirmed that the Department of Health does not segregate patients based on their documentation status. This means that foreign nationals, regardless of their legal status, are entitled to receive medical care at public health facilities. This policy underscores the country's commitment to human rights and the principle that healthcare is a fundamental right for all individuals. While some critics argue that the influx of undocumented foreign nationals is placing undue pressure on the public healthcare system, Dr. Motsoaledi has pointed out that the real challenges lie in structural issues such as underinvestment, maladministration, and systemic weaknesses. He stressed that these are the areas that need to be addressed to improve the quality and efficiency of healthcare services in the country. The health minister's stance has garnered support from various quarters, including human rights organizations and medical professionals, who view the policy as a step towards a more inclusive and equitable healthcare system. They argue that healthcare should be based on need, not nationality or documentation status, and that denying care to anyone is a violation of basic human rights. However, the policy has also faced criticism from some sectors, particularly those who believe that the influx of foreign nationals is straining the resources of public health facilities. They argue that the government should prioritize the needs of South African citizens and address the challenges posed by undocumented migrants. These debates highlight the complex and multifaceted nature of the issue and the need for a balanced approach that considers both humanitarian concerns and the practical realities of healthcare provision. In conclusion, Dr. Motsoaledi's declaration that no patient will be turned away from public health facilities, regardless of their documentation status, is a bold affirmation of South Africa's commitment to universal healthcare. While the policy has sparked debates and discussions, it underscores the principle that healthcare is a fundamental human right that should be accessible to all individuals, regardless of their nationality or legal status. As we continue to navigate the challenges facing our healthcare system, it is crucial to remember that the ultimate goal is to provide quality care to those in need. This requires addressing systemic issues, ensuring adequate resources, and fostering a culture of inclusivity and compassion within our healthcare institutions. So, what do you think about this policy? Do you agree with Dr. Motsoaledi's stance, or do you believe there should be restrictions based on documentation status? Drop your thoughts in the comments below. Let's have a respectful and insightful discussion. And before we wrap up, here's a little joke to lighten the mood. Why did the doctor carry a red pen? In case they needed to draw blood. Remember, all images used in this video are for illustration purposes only. The news sources for this video include News 24, Times Live, Medical Brief. Thanks for watching, then don't forget to like, share, and subscribe for more updates. Until next time, stay healthy and take care.